Blog Talk Radio.
You are listening to Dr. Guy Gumbo Talk with your host, Dr. Tanisha Guy, and her co-hosts, Steve J. and marriage and family therapist expert, Fatima. This show is not intended to be therapy, but the sole purpose is encourage dialogue across ages, gender, religious backgrounds, ethnicity, and sexual orientation. Feel free to join in the discussion. We want to hear what you think. And don't forget to tell friends about Dr. Guy Gumbo Talk.
Hello, everyone. We're back this Sunday, May 3rd, and May 3rd is, for me, Taurus turn-up month. So I am really looking forward to this month. I look forward to this month every year because it's my birthday month. So since I have that out the way, thanks you guys for tuning in to Dr. Guy's Gumbo Talk. As always, I think this show is going to be very informative, but yet entertaining. And so today our topic is what are the impacts of depression, anxiety, or bipolar in a relationship? And I chose this topic because May is Mental Health Awareness Month, so I think it's important that we continue to talk about this topic since there still remains to be a stigma related to this issue, even in 2020. And we have a guest joining us today. Well, he's a guest, but not new to the show, and so I'm going to introduce him in 1 second. But hey to my guest, hey Steve. To my co-host, hey Steve.
What's going on? I'm glad that we're going to get some insight in how some of these emotional terrorists might be created today.
You know what? That actually might come up, Steve. It might come up. And Fatima.
Hello, Dr. Guy. It's another lovely Sunday afternoon, and I'm ready to dig into it.
Okay, great. Well, I'm going to introduce our guest today, and you guys have heard him on the show before, so I'm glad he's taken an opportunity to come back. Our guest today is Dr. Malik Rahim.
Hey, how are you all doing?
Hey.
How you doing, Sister Fatima? How you doing, Brother Steve?
I'm good.
Hi,
Hello?
Dr. Malik.
I see.
we all
Steve
are well
like
here.
poking, I see Steve like poking fun of people, just going after people.
I'm just conscious that there are sects of sleeper cells of terrorism out there. So,
hey, as
But
a
you know
Muslim,
what?
I don't like the sleeper cell terrorist comment, but hey, I understand what you're saying.
We might actually have to do a show on that topic, Steve, because I think it goes both ways. We have those emotional, I don't even know what a better word is other than terrorists, Dr. Rahim, but I think sometimes they can truly be terrorists, unfortunately.
Right. I do want to make a complaint before I greeted you last, Dr. Guy, because I want to make a complaint.
A complaint? Oh, okay. I'm listening.
Yes, you have me on the show after you had Sister Renee Greer and the Love Doctor to the World. And I got to follow up that.
Oh, my.
I got to follow up those two outstanding individuals.
Now, you know what?
Oh,
I did not. Look, I had Love Doctor of the World, Corey, on the show. I did. Corey Hughes was on the show. And I've been trying to get him and Renee Greer on the show. So my hopes, we have that planned coming up, that I will have both of them. So Renee called in because she took a break from doing some of her work, and so I'm glad she was able to catch the show last week. But, yeah, last week, that was a show last week. So this one might be a little bit tough.
I was like, man, I got to follow up those two outstanding individuals? Oh, Lord. Oh.
I know. You know what? But I'm not even worried, Dr. Raheem. I know you're going to bring it. This is such a topic that you are so passionate about. And I think it's one that we always need to talk about. And speaking of talking about this issue, you have a YouTube channel. So these are some of the issues that you talk about on your YouTube channel, right?
Yes. My YouTube channel is strictly educational. My audience is for anybody who want to learn about the different issues and different topics in the mental health, mental illness arena, and I kind of give a lay person understanding on what's going on, definitions, and some of the signs and symptoms and things that you can recognize, and try to reduce the stigma, and also be like a pseudo study guide for new counselors. If they are like still in school or they're working on their master's or even their doctorate, to kind of like give them like a little study guide on talking about different some of the different topics that they'll be talking about in class and going over the different theories and different things like that. But every now and then I do talk about you know some of the psychosocial issues that's going on, because I know I had you and Brother Steve on the show talking about relationships.
Well, I
so
definitely
you're
think that this.
in my
I think that this is a topic that is. Can you hear me, Dr. Raheem?
Yes. Yes.
Oh, I was going to say, if this is a topic that people want to hear more about, and again on that, to seek further education about it, to definitely go subscribe to your channel, because you are constantly putting out videos to educate individuals in the area related to mental health. So thank you for doing that.
No problem.
Today I just kind of want to start off with, I want to talk about this topic because, as you guys know, I am a licensed professional counselor, so I'm a clinician. I see clients, and this topic comes up in sessions, whether it's individuals or my couples, and it definitely impacts how people relate to each other. And so sometimes I think people don't even know that they have a mental health issue because they haven't been formally diagnosed, but they report all of the symptoms. And so I just want to first start off by asking you guys the question, how do you think individuals present in relationships when they have mental health issues? And you can select a specific diagnosis or just in general. What does that look like? Because I want our listeners to know, because for some of them, they're in these relationships. They're with people who have a mental health issue, and sometimes they don't know. So what do you think that looks like, you guys?
Well, I guess I'll go first. I guess I'll go first. Yeah, I think it depends on the diagnosis that the person is presenting with. There's a new push, I guess you could say, for PTSD, but it's called complex post-traumatic stress disorder. And just kind of piggybacking over some of the topics that I've been hearing on your show lately, it kind of feels like that is kind of like some of the things that some of the individuals been presenting with. And I'm not trying to diagnose anyone, But it's like what complex post-traumatic stress disorder is it's a constant barrage of you constantly being in battle with that same trauma. And so the thing about it is that, and it keeps bringing up those triggers. And one of the things that can happen is just like with bipolar, you can get hypersexuality. And that increased the possibility of being unfaithful, increased the possibility of lacking in trust and commitment. You can have things like personality disorders where the individual have a hard time showing empathy and looking at the person's situation as being able to relate to them. And that can create like gaslighting, insensitivity, defensiveness, and stonewalling within the relationship.
Those are good examples.
I'm sorry?
I said those are good examples.
Oh, I'm sorry.
Yeah. So I'll touch on depression. I think, and specifically if we think about Black people, because we are a group at high risk for depression. And I do want to add the caveat of saying that everybody, like, experiencing or having a moment of being depressed is normal, right? Everybody can go through something or have some moment in their life where they're feeling depressed. Maybe certain times of the month you might be more likely to be depressed than others. But if we're talking about clinical depression, you'll see those people present with, and this is actually pretty broad. So the range of symptoms are pretty broad. So it could be anything from someone who is hopeless, like they tend to present as always being hopeless, or incredibly sad, sometimes thoughts of suicide. But then on the other side of that, and also this is a really good one too, like lack of pleasure or interest in doing things, doing activities. So if you're in a relationship with someone like this, there might be someone who tends to want to just kind of maybe like stay in the bed. They're not very happy. Perhaps they're crying very often. You could also see, on one hand, you could see someone who's not sleeping very much, insomnia, but you could also see someone who's very restless and isn't able to sleep at all. With the cognitive stuff, you might see lack of concentration or just in their activities, just slowness in their activities. So having really a hard time getting going, like just getting their motor going, and not being able to really complete activities of daily living. So things like getting out of bed, combing your hair, brushing your teeth, getting dressed, even sometimes inability to go to work and just be functional, and inability to find joy in not just the small things but big things. And so in relationship or in a marriage, if you think about someone who this is their daily living, like they are, tearful, stuck in the bed, hopeless, that starts to take a toll on their romantic partner. So then that leads into a host of other things.
Right. If I could add something real quick, every relationship you got to put a lot of work in. All right, and it's like I'm sure that all of you all will agree that just because a person has a mental health condition doesn't mean that they cannot be in a relationship. It's just going to be work, just like in any other relationship. Just like Sister Fatima said, some of the signs and symptoms that you might see And that's not only with just clinical depression, but just depression. When they're having the blues, their mood can change. But it's like you can see these things, and it's going to take a lot of work, and it might take you having a little bit more compassion and empathy and working with them to get through the struggles. But I don't think it's impossible. But it's just like any other relationship. It needs a lot of work and a lot of caring to help the relationship grow.
Absolutely. I'm glad you mentioned that, Dr. Raheem, because again we're talking about mental health issues because there is still so much stigma attached to it, and I think that's one of the reasons why sometimes people don't share with their partners, even though they have been diagnosed in the past. They won't share with their partners that they have this diagnosis because they're fearful that the person will either judge them or think that they're incapable of being in a relationship. And so I'm glad that you made that point. I do see, before I come to you to get your thoughts on this, I want to go back to something you said, Fatima, and I thought that it was a good point. You made mention to the fact that people experience depression. You don't have to have a mental health diagnosis to be depressed.
Right.
And especially during times like now, right? People are experiencing situational depression because of COVID-19. So all of those symptoms that you might have reported, they are experiencing them right now because of where we are. But what they will tend to notice is that once things change for them as it relates to this situation, those symptoms will be eliminated. So I think it's very important for people to know that what we're talking about today is clinical depression. We're talking about someone who this might be your baseline, and it's not necessarily like this all the time. But what I mean by that is that things could be going great in your life. Job is great, family's awesome, but yet you still feel hopeless. You still feel helpless. You report that you are not interested in the things that you used to be interested in. Your sleeping is disturbed. Even your appetite has changed. And when someone says, is there anything wrong, your response is, no, like I can't think of anything, but yet you still experience these symptoms. And so that's a little bit different than when you talk about someone who is just dealing with situational depression. So, Steve, what are your thoughts about the impact of mental health issues in a relationship?
Well, I think one of the things you want to start with is your background, because that always plays a large portion in how you've been trained to process things. So, if your environment was one where there was depression on your parents' behalf, or that's how you saw people cope with issues and stress was through depression, then by default, that's going to be something that you pick up just because of your nurturing and nurturing situation.
So yeah, possibly it definitely could be some learned behavior. You're modeling what you see. So I want to talk about bipolar. And I worked in a psychiatric hospital for several years, and this seems to be one of the revolving diagnoses that we saw in the hospital. And yet this is one of the ones that I hear that is thrown around so many times by people as a reason why they cannot do something or as a reason why their relationship is failing. It's because, if you guys have seen me, I'm doing air quotes, I have bipolar. And so I just kind of want to talk about bipolar for a second and really help people understand what bipolar is. Because people will say, oh, my goodness, I am so moody. I think I have bipolar. And being moody is not a criteria for having bipolar. And so there's the distinction between bipolar 1 and bipolar 2. And the distinction is their manic episodes and hypomanic episodes. So someone who has a true diagnosis of bipolar 1, they're going to have these manic episodes. And these manic episodes include times where they have high energy, where they can go days, it could be 3 or 4 days, maybe even a week, and there's a reduced need for sleep, but yet they're still able to function, which is very abnormal for most of us, right? If you go if you're hitting 72 hours without sleep, you're going to definitely experience some deficits. But for the person who is experiencing a manic episode, this is a time where they're still moving, they still have high energy. But what they also experience is they begin to have a lose touch with reality. And so those are some things that they're experiencing during this manic. They're impulsive. Their decision-making is irrational. And so you have the one side, which is the mania, and then the other side of bipolar is the depressive side. So when someone is experiencing a depressive episode, this is where they might have a change in their energy. Now they have low energy. They lack motivation. There's a loss of interest in things that they were doing before. And this is where the mood episodes can last days or even months at a time. Oftentimes what you'll even hear from this person is they'll talk about having some suicidal thoughts. And so there's this extreme that people think bipolar is, I'm just moody, so that means I have bipolar. But no. In order for you to have a true diagnosis of bipolar, those are the symptoms that I just mentioned. You have to meet that criteria, and they have to be present for a certain amount of time. Bipolar 2, the symptoms are very similar. The only difference is the individual has what's called hypomania, which says instead of them having these huge peaks of mania with all this energy, they kind of go to the middle, so they don't peak in that respect. But these individuals often occur problems in their relationships because during either a manic or a depressive episode, their decision-making is poor. So they do things either to their mate or to themselves that really make it difficult for the person that they're with to kind of understand the behavior or even move past what that person did. For example, I remember one client during a manic episode maxed out all of the credit cards and emptied out all of the savings in their account and just blew the money, like in 2 days. And when the person's spouse was like, I can't believe you did that, and was so upset, by this time they were falling into their depressive episode, so they were completely out of touch with what they had just done. It was like, so I spent all this money, but don't pick on me because life isn't worth living and I don't want to be here anymore. So it was so difficult for this couple just because of the poor decision-making on the person who had bipolar. So I definitely want to make sure that people understand what true bipolar 1 or 2 is and what those symptoms look like.
Right. Sometimes if they're not properly diagnosed, what I find is that, and I talk to my students about this a lot, and sometimes people get confused between borderline personality disorder and bipolar. And one of the things is like, if you're having mood swings like that, and you're being sincere and you're having mood swings like that, you might, and I'm not trying to diagnose anyone, like you clearly stated, the caveat is the disclaimer is that this is not therapy, but it might be a sign of possible borderline personality traits at least, because usually borderline, they have mood swings, but they're fast, right? Which is like, but like you said, bipolar, the mood swings are longer. They take longer. You could be in manic or hypermanic for days or weeks and then go into your depressive states. But it's like with borderline, it can be a day, it can be a couple of hours. The mood swings are faster, right? And they have the emotional instability, they have the insecurity, they have the impulsivity, but that's part of their personality, right? That's part of their hardwiring. And the thing is they usually have a difficult time in intimate relationships.
Very difficult time in intimate relationships.
Because of the fear of abandonment.
It's not a causal. I'm sorry. I was just going to say it's not that one causes the other, but there's a correlation between individuals who have a history of trauma who have also been diagnosed with borderline personality. And you begin to see some of those symptoms being present as well.
Right. But I wanted to add something with something that Sister Fatima said and something you said. Although this conversation is more on the clinical side, I would encourage anyone who's listening that if you are having, generalized depression as far as the condition that's happening with COVID-19, or you are having issues of stress, that you do go and get counseling, that you don't think counseling is strictly because you have a mental illness. It's
right.
help you to be able to cope and get through life situations. So it's like I've got a lot of people on the front line, like yourself, like Sister Fatima, like Sister Renee, that are out there working, and a lot of my former students are out there working. I wanted to make sure, because the stigma is that, oh, you're going to counseling, you must be mentally ill. If you must be, must have something wrong with you. Or they'll use that C word, crazy.
Exactly.
Right? And I despise that word. But the thing is that counseling is to help you developmentally get your life where you need it to be. So it's like a lot of people, the unemployment rate's going up so high. A lot of people attach their identity to their career. And this can cause serious, not only trauma, but issues going on. And so it's like I would encourage everyone that you seek help and get counseling, because counseling doesn't mean that you can be diagnosed with a serious mental health issue or mental illness, but it's like it's things to help you to get healthy, and we need to take our mental health seriously as a community. So I just want to throw that out there.
Absolutely true, Dr. Rahim. I totally agree with that. And you said to throw the C word around, and I say this all the time, that counseling is not for crazy people. Counseling is for people who want to learn how to cope. And it doesn't matter whatever they're dealing with, their goal is just to learn how to cope. And so that's why they reach out for help. One of the things that I was thinking about as you guys were talking was, whenever a client comes into my office in the first session, I always go over this form and I get background information, right? And so one of the questions that I ask is, do you know of a history of mental health disorders in your family? And I'm often surprised when I ask that question, and sometimes people's eyes get really big, like, what? Like, in my family? Like, no, we don't have no mental health issues in my family. And so I then go on to explain. They'll say, oh, no, we don't. That type of thing doesn't run in my family, as if there's something wrong with someone who has a mental health issue. But then I go on to explain that there are a lot of individuals that have mental health issues. They're just not diagnosed yet, right? But when you think about families, I don't know, really, to be honest, one person who does not have a blood relative that does not have a mental health diagnosis. To be truthful, I don't know anyone that does not have it. And so what I then go on to explain is that when you think about mental health issues, it's very similar. We talk about, like, diabetes. So if, let's say, my grandmother was a diabetic, I might need to be more cautious about how I eat because my grandmother is a diabetic, and it runs in the family, right? Mental health issue is very similar, which is why it's one of the questions that's asked on my assessment. And so I try to explain to them that oftentimes there's the gene that just lies dormant in all of us, whether it's the anxiety gene, the depression gene, whatever that gene is, that mental health gene, it lies dormant in all of us. But then it becomes activated, in most cases, by a scenario where we experience trauma. And that is however you perceive that traumatic event to be. And that becomes the light bulb. And so I get a lot of early college-age students. So they're like 19, 20, 18, 19, 20. This is their first or second year at college. And now they're struggling because, they're away at school. They're dealing with some anxiety. They're dealing with depression on top of trying to create this sense of independence and then have these relationships with people, and it's not going well. And so I think it's important for us to know that when you start dating someone and you believe that this is looking serious and we're heading in that direction, one of the questions I think that people don't ask because they're not in our field and they don't think about asking it, but you might want to know if there's a history of mental health that they are aware of in their family. Because it is very likely that this person might also exhibit those symptoms, but they've never been diagnosed. So, we talk about couples should always ask the questions about finances when they get to that serious point with people. Great. I agree with that question. But I also think people need to start doing a little bit more digging, and they need to explore their mate's mental health before they decide this is the person that I want to spend the rest of my life with and marry, because oftentimes they don't know what they're getting into in the beginning of the relationship because it has not presented itself. So that's kind of what I want to segue into now is, so let's talk about individuals who know they have a mental health issue, right? Doesn't matter what this mental health issue is, but they haven't told their mate. And now they're into this relationship and they have their first flare-up. The mate sees it for the first time. What happens in these relationships? You experience your mate depressive episode for the first time. You experience your mate having a panic attack for the first time. You experience your mate having a manic episode for the first time. Or, on some extreme cases, you experience your mate having auditory or visual hallucinations for the first time. What happens in these relationships, you guys?
Well, I think most often than not, it's probably there's an increase in a decrease in relationship satisfaction. I'm sorry, I cannot talk today. A decrease in relationship satisfaction and an increase in discord. You'll probably see a lot of that. I think if the one partner who's unaware that there's mental illness, it's probably shocking depending on exactly what it looks like. It could be frightening. And so it really, I think, would come down to an individual thing on how that person deals with it. Now, if this is someone who might be aware of mental illness in their own family and they've seen something like this before, they might be able to rally in a way and be where it's a little more seamless. Whereas for some other people that this is completely foreign to them, they may not know what to do. And it could be deterrent. Like it could be something that makes them think, I got to get out of this. In fact, I'm actually glad you brought this up because I was reading an article from the American Psychological Association about mental illness as a relationship deal breaker. And in this article, it's from 2018, and one of the things that they talked about in the article is how for most people, finding out that there is some mental illness in their partner, it often led to rejection of the potential mate. So that's knowing ahead of time, which is probably why someone might be fearful of disclosing that information. But I think part of that, too, is because of stigma. We don't have conversations like this. We don't normalize mental illness. I'm glad that you mentioned, Dr. Guy, that it's actually pretty common. And you know, most of us, if I think about my own family, I can't actually say I know someone who's been diagnosed with a clinical disorder, but I know some people who probably should have been. And the truth of the matter is because we don't have these conversations, they could have the diagnosis and just have not shared it because we are afraid of how that makes us look and, you know, different things like that. And so we're afraid to talk about it. And then also in our community, you know, the stigma is so great. What does it mean? Does it mean I'm crazy? Does it mean, you know, I'm somehow not worthy of love or relationship or respect? And so I think all of these things prohibit people from sharing this information. And I actually think if we could start to have more conversations and normalize mental health disorders and mental illness, and really have a real understanding of what it looks like and how you can still be in a successful relationship, then I think we might see less of people feeling like, oh, this is a relationship deal breaker. I also want to mention, and I'm going to wrap up because I know I've been going for a while, but I also want to mention another article that I read in the Journal of Marital and Family Therapy, which is where I live, and they talked about how marital support, they did this long national study, and what they found was that people who had a lot of support from their significant other, from their partner, and people who had clinical mental health disorders, even bipolar disorder, and they specifically talked about bipolar disorder in this article. So they looked at bipolar disorder, externalizing, fear, and some other disorders that I can't say off the top of my head, but what they found was significant evidence that when spouses were very supportive and engaged and engaging with their partner, that they started to see decreases in a lot of those, in a lot of the symptoms, even with bipolar disorder. So there is something there for being a supportive partner, being involved in your partner, being loving and caring, that could actually help. Now, I'm not going to say it heals it. I'm not going to say being a good partner is the cure, but I'm going to say that what we found is you see a decrease.
One of the fears I have, especially in the Black community, is I've seen it, in some areas. I know in Chicago when you were working at Chicago State, you attempted to try to help bridge the gap between the Black church and the mental health community. And I think more of that needs to happen in our community, because a lot of times as a people we'll believe that, because of our strong spiritual belief in God, that, this might be a test from God as far as a condemnation on our faith, like depression or bipolarism or something like that. So it's very important that the church, the Black church, get on board with the counseling community and the mental health community to help the community as a whole understand that the stigma is not real. We got to fight that stigma. The example you used, Dr. Guy, I have some other concerns, because if they're bipolar and they're having those episodes, my concern is, are they doing their medication properly? Have they even been diagnosed truly? And if they're taking care of their medication properly? And if they're going through them stuff, I'm sorry.
Oh no, go ahead.
Oh, and so it's the thing is that it's Sister Fatima said, that a lot of times that stigma is a fear of it's going to be a deal breaker if I tell this person, if they've been diagnosed, that I have bipolar. And it can be a smorgasbord of reasons on why they might not be taking their meds, or other reasons on why they have these episodes. But the thing is that it's like Sister Fatima said, that usually once you see these, symptoms come up, the hypermania, the mania, the severe depression, a lot of times is because of the stigma, it's a deal breaker. It's beautiful that she cited some articles where the couples work through it together, and that support helped the person help battle their symptoms and have battle their condition. But a lot of times, unfortunately, because of the stigma, it ends up being a deal breaker.
Mm-hmm.
Absolutely.
I definitely think.
And
Can we get
I
Steve
was
in
agreeing
here?
with
Steve
the
still here? Is Steve still here?
I'm just listening and learning, trying to connect the dots to some of my experiences.
I wanted to add to that. Oh, go ahead, Steve.
No, I just said I want to think, definitely make a connection to the church and, the idea of they're having some mental problems in the past being connected with, demons and, people that, needed to be healed. And, I think that was a different pathology that is kind of plagued us in the past. So, but that's all.
Fatima?
Yeah, I wanted to piggyback off Dr. Lee and say that actually I forgot what I wanted to say. But, yes, I remember talking about the support. So I was working on some research about couples and caregivers of Alzheimer's patients, and one of the things that we found was that when women are diagnosed with chronic illness, their partner, whereas when men are diagnosed with chronic illness, their partner is more likely to stay and ride it out with them. And so I thought back to that when I was reading this article about marital support, because one of the things that they noted was that support of a man who has a mental illness is marriage and relationship is actually more of a protective factor for him than they see for women. And it made me wonder, I wonder is that because the women are more likely to stay and more likely to be supportive in that relationship. Now, I can't say that definitively because they just gave this information and I'm tying it to some other research. But I did find that interesting that for men in particular, having that supportive partner, you see less of those externalizing disorders, which is when I'm talking about externalizing disorders, I'm talking about alcohol abuse or dependence, drug abuse, and conduct disorders. You also see a decrease in internalizing disorders. And by internalizing, I'm talking about your major depressive disorders, your generalized anxiety disorders, your PTSD, post-traumatic stress disorders. You see a decrease in fear disorders, which is going to be your panic disorder, and that's with and without agoraphobia. And then for bipolar disorder, it's bipolar 1, 2, and mania. So having a supportive partner and seeing significant decreases in a lot of the behaviors and the symptoms of these partners really says to me that, in a lot of ways, a good relationship is like medicine.
Fatima. Did we lose Fatima?
Yes.
Fatima.
Hey.
The last
Hello?
thing you said was, the last thing you said it was like a good relationship is like medicine, and then we didn't hear anything else.
I think that was the end.
Okay. I'm sorry. I thought you were going to give us something else about a good relationship is like medicine because...
a good relationship is like medicine because, but once again, I do want to make the note of saying I'm not saying that a good relationship is going to heal.
Right. Can I jump in on that, Sister Fatima?
Yeah.
Well, it's like if you, and it's funny because I joke with my students and I tell them that love is a mental illness, right? And one of the reasons I say that is because if when you look at neurologically the brain, when a person's in love, the neurological transmitters light up, just like when they are on like high, like speed, like cocaine. And so the thing about it is like that adrenaline of being in love. Now, this is just a theory. I have no research on it yet, so just take it with a grain of salt. But this is like the and the loving and the caring that you get in a loving relationship can help you feel that, you know, that you are not alone in this and that you can conquer the world. So it's like your brain transmits these types of things and sends out that adrenaline and helps you as far as like, you know, battling just about anything you can. Because it's like the thing is that it's been like, you know, with some not great numbers been shown how much support and love that a person get when they have like cancer, how it helps them battle that. So it's like I can understand what Sister Fatima is saying as far as like how love and support can help the person as far as their symptoms being lowered. It's not a cure like she was saying, but it can help because of the dopamines and all this that happens in the brain. It lights up and it helps you as far as like fighting off different things.
You know what? I think that goes back to support why it's so important for us to have the discussion that we're having today. Because the more you know, the more educated you become, the better you are able to deal with the scenario that you're in, whether you're the one who's dealing with a mental health issue or if it's your mate. And so one of the things that that came up in
one of the things that I'm concerned about is the not diagnosed. Like the complex post-traumatic stress disorder. And it's like the thing is like if I was faithful and I get cheated on and that devastates me, and then I get into another relationship and I get cheated on and that devastates me, right? Now, every relationship I get into, those warning signs going to come up, and it's going to be hard for me to get involved in a relationship, and then I'm going to be throwing out things that's going to be self-destructive and causing that relationship, the next relationship, to possibly end, right?
So this person is going to self-sabotage.
Self-sabotage possibly down the line. And so the thing is that if you did get involved with somebody, like say, for example, that was bipolar, and they either told you or they didn't tell you, and they went through one of their hypermanic stages, and they were unfaithful, right? See, the vicious cycle is they're going to keep going out doing that, right, to everybody that they're in. And then now I'm going to, the one that got cheated on, I'm going to create this mental health condition of complex post-traumatic stress disorder because I put everything into this. This was my Lupita Nyong'o. This was it. I put everything into this, right? And now all of a sudden she cheats on me, and now I don't trust no other woman, right? And I'm not trying to put gender on it, but since I'm a man, I'm going to say a woman. But it could be a woman that goes through this as well. So it's like the thing is that, and it's just this vicious cycle. So it's like the effect that person that has bipolar and they don't tell their mate and they're not really working on trying to make sure that they got this condition under control can do a lot of damage throughout the community.
But they do, and I think it goes back to what you said, not being diagnosed. There are several individuals who are having problems, and they've had these problems for years, and they've just kind of wrote it up as, this is who I am, it's a character. It's one of my characteristics. Not really knowing that this is bipolar or, again, one of the other diagnoses. But when you look at mental health illness, it doesn't matter what the diagnosis may be. There is an article by April Eldermeyer. She's a psychotherapist, and in her research, she reported that the way individuals are impacted in these relationships is that the person who has the mental health issue, they deal with shame and guilt just because they have the mental health issue, because they internalize that there's a problem with them, right? So that becomes their narrative. Now, because of those narratives that they've created, it can then create other issues, like related to intimacy. So what some people, and I love it when my couples come in and I meet with them together and then I meet with them separate and these issues come up, people are unaware that a mental health issue can create intimacy problems, right? Like whether the person is just disinterested in sex, or the person might be taking a antidepressant medication that has decreased his or her libido. But they don't know this because they're not talking about it. They just angry at each other because they're having some intimacy problems, right? So that creates problems. And then you also have the issues of just codependency that's being created between the two parties, the one who has the mental health issue with their mate who doesn't. And so when you think about how this shapes the relationship, it really runs it into the ground because people are most likely not talking about the true facts. But the issue is you have a mental health issue, and in many cases, you're not treating it correctly. So, Dr. Rahim, you brought up medication, and I want us to kind of touch on that because as a professional counselor, I always tell my clients I'm about skills over pills. Now, what does that mean? It means I think you need to start doing the work first before your first response is to let me just run and get a pill. Because what we like to do, because we're in an instant gratification society, is we just want to get fixed. And we think the psychiatrist or the primary care physician that's going to give us that prescription is going to fix this. That doesn't fix it. And so I definitely want our listeners to know that the best form of treatment, and I want you guys to chime in too with what your thoughts are, but my belief is the best form of treatment for mental health issues, number one, I think you need to be doing the talk therapy. Like, you got to talk to these things. You got to understand what's creating it, what your triggers are, what your patterns are. Until you can understand that, you're really lost in your diagnosis. And then secondly, if medication is something that they're looking for, I think they need to be doing them in combination. I do not think that someone should just go get medication and not do the therapy. And I see that a lot with people with anxiety. Like, primary care physicians will write a prescription for Ativan like they giving Tic Tacs. I'm like, really? You just going to go ahead and write that prescription for Ativan, but you're not going to send them to a therapist? And yet their anxiety might be managed until the next crisis comes up. And now what has happened is, instead of them just feeling overwhelmed with their anxiety, it has now led to a panic attack. And they're in the ER because they thought they were having a heart attack. And it's the person in the ER who's like, baby, you ain't having no heart attack. That's just anxiety. Go ahead and go talk to this therapist, and we'll see you later. But those are the ones that I kind of have issues with. So what do you guys think? Because I do know that people who are listening, they either know somebody who has a mental health issue, or they're with the person, or maybe it's them. So how can couples improve their relationships when one has a mental health issue? Or in some cases, both of them have mental health issues.
Well, I would say I would agree with you wholeheartedly that talk therapy, the having a therapeutic relationship with a counselor is the first and foremost thing you can do. And if you are assigned to medication therapy, that you make sure you take your meds and that you work out your medication management not only with your physician but your counselor as well. And you do the things that need to do to make you have a mental wellness. as far as the couple is concerned, I have not read the article that Sister Fatima was citing, but I'll cite it without having read it based off the trust of her. And I think it's very important that together, that they work on it together. Regardless on who has been diagnosed, if you're in a partnership, that's part of your partnership, and you trying to help your partner have mental wellness so you can have mental wellness, and that way the household can be healthy as well. So the support and love is, you help your partner, and you work with your partner to get through this condition that they have been diagnosed with. So I think that is very, very important, especially if your partner was vulnerable and told you and shared this with you, that you create that safe space and be supportive of them, and and work with them, and possibly look into having couples counseling or family counseling. If the whole family's impacted. So I think those, because I think it's not a journey that person needs to take alone if they're in an intimate relationship. Because you're there with them. It's supposed to be a partnership, and if they shared that with you, and they were vulnerable, and you're trusting to see it through, then I think you should see it through, and you help them work through this, because it's impacting you too.
Absolutely. Steve, I know that this is a topic that is for you on the observer side. So as a non-clinician, if you was in a relationship with someone and she had confided in you that she has a mental health issue, how would you proceed with supporting her in that? Or would you even be supportive in that process? Steve?
I think he fell asleep.
No, I'm here. I'm just taking everything in. I've had a myriad of experiences. So I'm trying to draw from it, to be honest with you. I don't really think I have anything that kind of parallel with this.
But moving forward, let's say the person you meet in the future has a mental health issue. She tells you that.
Yeah, I'm not good with that. I'm gone. Don't act like that.
Oh, Steve, did you say you're gone?
I'm gone. It depends on what the mental health issue is. If it is, maybe a little depression, that can be something that can be worked with. But hypochondriacs, no. Nymphomaniac, no. Bipolar, nah. We could be friends, but I'm just not, at a point in my life where I want to bring that into my circle. So, yeah, I'm going to have to pass.
Wow.
Well, I appreciate
Steve's
honesty. I appreciate Steve's honesty. I think everyone is not going to be able to handle it, right? And so I appreciate Steve's honesty. I will hope that over time that he will grow and reconsider that position. But I really do appreciate your honesty, Steve, because it's like a lot of us, can't be honest, because it's like we'll say, I'll stick it out. I'd be with her. And the thing is, like, we really don't necessarily know what we're going to do until we're actually in that situation. So I really appreciate, and I commend you for your honesty. But I will hope that, over time that you will grow and you will reconsider. Real quick before you reply, I also like the fact that you didn't necessarily say that you will cut them off, that you could be friends, right?
Oh, yeah. So, I definitely like my own reality show that I can, check on live and in person. But, since I have kind of dealt with, some of these situations, it's not something that, I want to repeat. Like, this will be a little graphic, but, it won't be too bad. So I was intimate with this lady, a woman at the time, and she called me somebody else's name. I thought it was a mistake, and then, but she did it again, and she did it repetitively. So she had went to another place where I was no longer Steve, I was Jimmy. And so after that encounter, Jimmy was her former boyfriend who may have been slightly abusive, and although I appreciated her time and effort, we no longer needed her services.
You know what? This
see the thing.
This is why some people don't want to talk about their mental health issues. I think because of the fear that they will receive responses like the one you gave, Steve. And grant you're honest, so thank you for that honesty. But I do think that's why people are so hesitant to share that they have a mental health issue.
Well, Dr. Guy, from my perspective, if this gentleman had such a hold on her that being intimate with me, she still thought of him, I just didn't think we had a future. Like, it has nothing to do with, her and her mental issues. I felt like whatever hold he had on her, was of biblical proportion, and there was no need for me to waste my time and, try to counteract that.
Okay. Because I was thinking, if this is someone who has a history of trauma, then it's unresolved issues related to her trauma that she would most likely need to work on. But you just said that's not something you want to deal with. So again, thank you for your honesty and for that example. But I think that is the very reason why people keep this a secret from the person they're in a relationship with until they can no longer keep it a secret. And then that creates more problems. Because now I'm in this relationship, I love you, we're married, we live together, and you didn't tell me that you had bipolar. But you emptied all our checking account and savings account. So what do I do with that? So what I think happens for that person in the relationship is they feel like their choice was taken away and free will was taken away. Because if you would have told me this in the beginning, I would have had the ability to make a choice to either stay or go. But they didn't give them that. They didn't give that person that. And so now they're in it, and now they either do like you, Steve, leave, or they stick it out and then learn how to help their mate. But I do think that people are entitled to have a choice. And that takes their choice away when you don't tell them. That's just my thinking.
Well,
I'm sorry. Go ahead. That's right here.
I think one of the things that is interesting, I think, since Steve clarified a little bit more, the thing I was going to say is that Steve has been traumatized as well. Because it's like the way he was explaining the situation initially to me and all of us and all the listeners, I really, like I said again, I appreciate your honesty. I really love your honesty and your candor. But he's also been traumatized as well. The sister been, with her condition, has been re-traumatized. And now, like you said, that's one of the fears on why a lot of people won't, reveal their condition to people because of the fear on how they're going to be looked at. And I totally agree with you. But at the same time, it's like one thing I would encourage is like that, people anybody who's been in Steve's position realize that they've been traumatized too, because now like they're going to be looking at individuals who might disclose something to them and automatically go back to that first incident and say, nope, can't handle this, boom, right? So it's like I was saying earlier, it's like that ugly cycle that's going on possibly within our community as far as relationships when you're dealing with mental health conditions, that if you're not as supportive and something happens and it's one of your deal breakers and you release that person, now you walking around with that trauma too.
And while it's not, diagnosable, it's not a mental illness like bipolar, schizophrenia, or any personality disorder, it's still a trauma that you're walking around in. And I know this not, as far as the topic of what we're talking about today, but that's why I encourage people to actually seek out and get that cleanse from them before they start trying to start any new relationships.
Absolutely, because you could, like you said, you could traumatize the next person or the person that you're with because of your failure to do your own work. Fatima, because your lane is marriage and couples therapy, right?
Yeah.
What is it that you would like our listeners to know today if they're currently in a relationship with someone who has a mental health issue? What would you like for them to know or do to assist them in this journey that they're on?
If you are in a relationship with someone who has a mental illness, I would encourage you to, one, assure them that it is okay. This is not exclusive to them because there are millions of people who have a mental illness diagnosis, and they lead very happy and successful lives and have very happy and successful relationships. So it's not, it doesn't have to be a deal breaker. And I think that one of the most important things is finding out what are they doing about it. So if you meet someone and they disclose this information to you, one, honor the fact that you created, obviously, a safe enough space for them to feel like they can share this thing with you because they're probably very nervous about it. And so allow them to be able to feel like, okay, this was safe, this wasn't a mistake, I didn't do the wrong thing. But it's okay to ask some questions. Okay, what does it look like? What do your symptoms look like, when you're dealing with it or you're battling it? And are there any things that you are doing to help? Are you in talk therapy? Are you taking medication? If the answers to any of those things are no, well, I definitely would encourage you to encourage them to see a mental health professional. Hello?
Yes, we're here, Fatima. We can hear you.
I personally think it's beneficial for that person to be in individual therapy, but also in couples therapy. And I know if this is somebody you're just meeting, you're probably not going to be going into couples therapy with them. But if this is a marriage or an established long-term relationship, I would highly encourage couples therapy, but also encourage them to seek individual therapy. And here's the thing. If they are taking medication, time and time again, it has been proven that therapy combined with medication yields much better results. And so you want them to be their best selves, and the best way to do that if they are taking medication is to also be in talk therapy, because that's the best that they can do for themselves and to help themselves. Also, if they said something like, well, I tried the medicine one time and it didn't work, explain to them that with some of these disorders, it's not a one-time fix. So sometimes the doctor might have to make, sometimes the physician might have to make adjustments to the medication. Sometimes they might have to try a different medication. And so you might have to be patient in order to get just the right fix for you. But just saying, oh, I did it one time, I didn't like how it made me feel, or it didn't work, and then not doing anything, and you're going to go back to having all of these horrible symptoms, I don't think that's a good idea. Also, if you are on medication, for a lot of these medications, the worst thing you can do is stop cold turkey, because some of these medications can have horrible, horrible side effects if you just stop taking them. Some of them you actually have to have your doctor either adjust them or help you to taper off of them, so that way you don't experience the really bad side effects. So I'm somewhat in the middle. I am with Dr. Guy when she says skills over pills, because I absolutely believe in therapy. But I also think that if the medication is needed, 100% you need to take it. But don't go to your primary care physician's office and say, I need a prescription for Wellbutrin because I saw a commercial and it sounds like I have those symptoms. What you need to do is get yourself to a mental health professional who can diagnose you and figure out, okay, exactly where you are, and then steer you into the direction of where you need to be, and then who can best prescribe what it is that you need for your particular diagnosis.
Thanks, Fatima. That was a lot of good information. Dr. Malik Rahim, what would you like our listeners to know as it relates to dealing with mental health issues in a relationship?
Well, first of all, since Brother Corey is the love doctor of the world or the universe, as he proclaimed, I guess I'm the counselor educator of the universe. I think I'm gonna give me a new title too.
One thing counselor educator of the universe.
Yes. What I look at mental health and mental illness as slightly different things. Mental illness to me is something that's impacting your life that can be diagnosable through either the DSM-5 or the ICD-10. And I look at mental health as issues, as conditions that may or may not be diagnosable due to DSM, but might be impacting your life. I agree, with Sister Fatima's numbers as far as the statistics, as far as millions have, and 1 in 5 people have a mental illness, a diagnosable mental illness. But I will also look at it to where it's like all of us at some time have a mental health issue, whether it's stress, whether it's trauma, whether it's something like a personality disorder, bipolar, something that could be diagnosable. But we all at some time have a mental health issue, because just being black in, this universe can cause mental health issues, because, racism in our lives on a regular basis, whether it's structural, institutional, personal, or internalized, it's impacting us. So I would encourage everyone to really look at how these things are impacting your relationship, because as it was stated before, all of us want to be wanted, and all of us need to feel needed. And sometimes these issues are stopping us from possibly, moving down the line to actually achieve that goal. So it's like I would encourage you all to seek out mental health professionals. If you have been diagnosed with a mental illness, like yourself, Dr. Guy, and like Sister Fatima said, and you both said so eloquently, that you need to go seek counseling. If it's determined that you do need medication, don't take that medication as the sole therapy. Use talk therapy. Sister Fatima, like she just said, talk therapy and medication will use the best result over just simple medication. And actually, talk therapy yield better results. Talk therapy alone yield better results than medication alone. So I think it's very important that we get these issues addressed and that we build safe, protective environments where people can share and be truthful on things that are going on with them, with their partners. And like Sister Fatima said, that we learn to go through this together. I also agree with her caveat that if you just start a relationship, maybe you don't need to go through couples counseling right away, but the person should be individual counseling. The only fear I have is that demon called managed care, how it has impacted our profession so hard. But I really encourage everyone to seek out counseling, and especially now because we're being impacted so devastatingly on our mental health and our physical health with this COVID-19. And I believe it was you, Dr. Guy, who said that it's very, I don't know if it was you or Sister Fatima, excuse me if I'm misquoting the person, but it's very few people who don't have someone in their family tree that had been having a mental illness to become easily diagnosable if they weren't diagnosed. So it's like I really encourage us to get these things resolved.
Thank you, Dr. Rahim. And Steve, what are your thoughts? What we'd like our listeners to take away from today's discussion?
Well, I just have to go back to something my grandmother told me. She said to me that everybody's a little crazy. You just got to kind of find you're crazy. So if you can find someone that you can deal with, who can deal with you, and you can get beyond what your crazy is and what her crazy, his crazy is, there's nothing wrong with dealing with somebody who has some issues, but there's something wrong with dealing with the guy they put in the basement under the stairs. You need to know what's the difference between that. So, looking forward, we all are going to have some issues from time to time, but, you need to be cognizant of someone who has larger issues that can be diagnosed. And also for women, I want you all to think, I've had some friends that have been on several forms of birth control that's been able to alter their personality and give them mood swings and things of that nature. So especially women who are on birth control, men, if you're on some other kind of medication, you definitely want to read all the fine print and find out what some of those side effects are, because sometimes, something as innocuous as some allergy medicine can affect your personality. So in closing, mind your medicines and find somebody that's your type of crazy.
Find somebody that's your type of crazy. As always, Steve, well said. You guys, I do think that today was a topic that was much needed for us to discuss. So many people struggle with mental health illnesses, and it greatly impacts their relationships. And just to summarize everything that we've kind of discussed today, some helpful tips if you're one of those individuals in that situation or you know someone. I think first and foremost, the individual and their mate, you have to educate yourself. You have to become informed about the diagnosis. The more you understand the diagnosis, the better you can treat the diagnosis. The other thing I think that is important for both the person who is dealing with the illness and their mate is to have some realistic expectations. Fatima kind of mentioned this about consistency with medication. If you are dealing with a diagnosis that causes a chemical imbalance, you cannot expect to take the medication once or twice or 3 or 6 months and think that your diagnosis will go away. Your diagnosis is something that you have to continue to treat, and that may mean long term. So that may mean you'll have to stay on that medication potentially if you're taking it long term, or that may mean you'll need to do therapy in and out at different times when issues arise. So have realistic expectations about what you are looking for in your mate who's dealing with this particular diagnosis. And then also keep in mind that, and I like how you said this, Dr. Rahim, about mental illness and mental health, and that they're two different things. And so everyone should always keep in mind that not only is it important to take care of your physical health, but you have to take care of your mental health. And those two are connected. And so if one declines, typically the other one also declines. And so you need to do whatever those things are to maintain health in both of those categories. And then my last one is also seek professional help. Mental health, or someone who's dealing with a mental health issue, it can be a challenge. And if you're not familiar with it, no one knows, no one has been diagnosed in your family, none of your friends have been diagnosed, you really want to be able to seek out professional help so they can better guide and assist you. So with that being said, you guys, thank you, Dr. Rahim, for coming on again today. Always your information is so informative. And hopefully we'll see some more videos popping up on your YouTube channel. And if you guys have not already done so, please go to my new YouTube channel and subscribe, and that is at Dr. Tanisha Guy. If you haven't caught some of our older shows, those shows are posted on the YouTube channel, so make sure you do that. Also, if you don't have to leave out, if you are not one of these individuals that have returned back to work, depending on what state you're in, do your best to stay inside. And if you don't stay inside and you do have to go out, make sure you're being safe. Wear a mask, social distance, 6 feet apart if you can. So with that being said, you guys, everyone have a blessed and safe week. And don't forget to Facebook it, tweet it, pass it on, tell a friend about Dr. Guy's Gumbo Talk. Everyone, bye-bye.